First FMLA is hosting this early childhood chat on COVID-19 vaccines and standard immunizations because while the early childhood vaccine has been available since June, only 10% of Los Angeles County's youngest children 6 months to 5 years has received it as of this month. To help increase this number, especially in the Antelope Valley and Wilmington regions, where vaccine uptake has been the least, First FMLA has teamed up with the Los Angeles County Department of Health to host this informative discussion about the role vaccines play in young children's health. The discussion will focus on vaccines for children 6 months through 5 years and why parents should vaccinate young kids against COVID-19. We hope that you will learn tips for staying healthy during family gatherings, childcare, and school settings. We also hope that you will learn more about the COVID-19 vaccinations for children prenatal to age 5. And we also hope that you explore why early childhood vaccinations are important. And we also hope that you are able to share your questions and concerns about COVID-19. Thus, we are very excited to have our panelists, and I'm very excited to share a little bit about them. Our first panelist is Dr. Claudia Martin, who is a board-certified family medicine doctor who earned her medical degree from UCLA in 2014. She is currently a physician at the Los Angeles County Department of Public Health, Division of Maternal, Child, and Adolescent Health. Dr. Martin has led various community-based and clinical projects. Her interest in working with the entire family unit, especially the child adolescent population, led her to work as a school district physician. She has also served as a core faculty and directed the community medicine, adolescent medicine resident rotation. Our following panelist is Mariela Cojon Hucup, who is a community ambassador with Para los Niños and the Project Innovations Los Angeles team. She has been working with community members for about 2 years, providing support around COVID and helping the community members find resources closest to them. She really enjoys working at Para los Niños, serving the community, and we're excited to have her voice in this conversation. And finally, we will have Violeta Recinos, who will also be in a conversation with Mariela. Violeta Recinos is part of the neighborhood leadership group participant with the Project Innovation Los Angeles team, where she has been working for almost 2 years. She has been inspired to work in her community and is really excited to be here with us to share her story on her experience with getting obtaining COVID-19 vaccines for her children. And finally, at the end of their presentations, they will be joined by my colleague, Marcy Manker, our Senior Program Officer and our Early Education team, who will be facilitating the Q&A session along with them. So without further ado, I would now like to pass it over to Dr. Martin to share her presentation with us. Thank you.
Thank you, Ruben. Welcome, everyone. I am very excited to be here, to be part of this webinar. The entire planning, we have done so much planning around this event. We hope that it will be of interest, and we hope that it will help you and your family to stay safe. So now for just a quick moment so I can begin to share my screen. Thank you. How does that look? I suppose that looks okay. I don't have access to that chat right now, so I will carry on. And let's get started. Thanks so much, Ruben. My name is Claudia Martin, like it was mentioned previously, pronouns she, her, hers. I am joined today by Mariela and Violeta as well, and I want to welcome them as much as I am here, and that information that I'm providing comes firsthand. Their narrative and their stories are very powerful, and are very much an important part of this event. We have lots of information to share with you and hope that this will answer questions and concerns. And with these main goals in mind, let's begin. So this is our agenda. First, a review of trends of COVID-19 and influenza in LA County, followed by the importance of COVID-19 vaccination and implications of infection for children ages 6 months to 4 years. And last but not least, the importance of routine immunizations as well. Information pertaining to pregnant people will also be presented. A reminder to please submit any questions you might have to the Q&A link or to the chat. First up, COVID-19. Here we have information from July 28th, 2020 to December 1st, 2022. On this graph, the green line shows the 7-day average of the number of cases reported daily. The orange line shows the 7-day average daily hospitalizations, and the blue line, the 7-day average number of deaths reported. I want to point out November 30th, 2021, before the Omicron surge last winter, which is indicated by the tallest green peak on this graph, with an average of 856 cases per day reported, compared to nearly 205,000 cases reported on November 30th, 2022, not too long ago. During the week of December 5th of this year, nearly 3,800 cases were reported per day. So we keep seeing these increases. What does this mean in the grand scheme of things? Well, 3,800 cases per day is actually a 40% increase from the week before and an over 200% increase from 1 month ago. It is important to realize that these numbers might actually provide still an undercount of the true number of COVID cases, and that the number of cases is likely much higher than reported because there are people who are doing tests at home, more so than ever before, I think. Along with the increase in cases, we also see an increase in the average number of daily hospitalizations and number of deaths as well. Currently, there is an average of 12 deaths reported per day, which is also an increase from the average of 8 reported a week ago. At this time, I would like to take a moment to acknowledge the loss felt throughout our communities as a consequence of the COVID-19 pandemic. We've been going at this for almost 3 years now, and now particularly during this end of the year season, I would like to extend my condolences as well as wishes for well-being and healing. Our next item, influenza in LA County. In LA County, it is very clear that we are seeing very high levels of flu activity for this time of year. We started very early on this year with this flu season, and we are continuing to see a sharp increase in the proportion of cases that are testing positive for flu. On this graph right over here, on your left, we track the current flu season, 2022 to 2023 in red, and show the past 4 flu seasons for comparison. The time in months is marked along the bottom, and the axis on the left represents the percentage of specimens testing positive for flu. So you can see that spike going right up, week by week. This past week, 30% of specimens tested positive for flu, and this was higher than the week before, when we were at 25% positivity. And with this in mind, we want to highlight that any case of flu can be severe. This is especially true in older adults and in young children. In the graph to your right, we have the percentage of emergency department encounters classified as related to influenza-like illness. And of particular note, we have in the blue line, light blue line, the age group of 0 to 4. So children are the this is the sector of the population that is visiting the emergency department for influenza-like illness more so than any other age group. And so I get this question asked a lot. What does severe flu mean? What does severe illness mean? So influenza, which basically can lead to hospitalization and or life support, specifically the use of medications to increase blood pressure to avoid shock, and mechanical ventilation or intubation. This is what we look for to vaccines to prevent this severe type of illness, prevention from severe episodes and complications from the disease. And so prevention is key. And in practical terms, here we have information regarding vaccine against flu and information about the COVID-19 updated bivalent booster. So the flu vaccine, who should get it? Everyone over the age of 6 months, so all children, for particular purposes of our presentation here, all children 6 months and older, if there are no contraindications, which there are very few. Why? Because it reduces specifically a child's risk of that severe life-threatening influenza that I talked about. It reduces that probability by 75%. Frequently asked questions: is it safe to get the flu shot and the COVID vaccine? Yes, it is. I'm actually a living proof of that. I don't have much time, and I was able to get both of them the same day, different arm, just done and done. Is it safe to get it during pregnancy? And the answer is yes. It reduces a pregnant person's risk of being hospitalized with flu by 40%. Vaccination during pregnancy helps protect the infants as well from flu in the first few months of life. And what are some side effects? There are side effects for everything. There are side effects for aspirin. There are side effects for Tylenol. What are the side effects here? The most common side effects are that sore arm feeling for 1 to 2 days, and tiredness, sore muscles, or fever. High fever is not common. Despite the many benefits offered by the flu vaccine, only about half of Americans get the seasonal flu vaccine for many, many reasons. And of particular note for us here, as of November 5th, 2022, only 31% of all children in California had received a flu vaccine. Regarding COVID-19 and the updated bivalent booster, statewide, only 17.7% of the eligible population has received the bivalent booster. Of all the bivalent doses, 64% have gone to those who are 50 and over. And why is it called bivalent booster? Because it protects against the original virus that causes COVID-19, what we call the ancestral strain, and the Omicron variants, specifically BA4 and BA5. The previous boosters are monovalent. They are designed to protect against the original virus or the ancestral strain. For the COVID-19 updated bivalent booster, hot off the press, as of December 8th, this booster is available to children 6 months and older, at least 2 months after their primary series has been completed. And we will talk more about this later in the presentation. And as a review, why should I get the bivalent booster? Because it is designed to boost immunity, to protect and match the variants we now see in the community, namely Omicron, which continues to be the dominant variant of COVID-19 in LA County and the one giving us the most trouble. In terms of vaccination trends in California, the bar graph on the right shows the cases of COVID-19 vaccines administered by age group for the past 4 weeks, starting on December 4th of this year. As pointed out by the red arrow, Children under 5 in that light green color make up the lowest vaccine uptake of all age groups. Only 6.6% of children under 5 have completed their primary series for COVID-19 vaccination. It is that time of year. It is not too late to get the flu vaccine and the COVID-19 vaccine and updated booster. A closer look at vaccine uptake reveals disparities as well in vaccine coverage rates among infants and toddlers, specifically in California. And here we present this information using the vaccine equity metric quartile system, with Q1 ranked as less healthy. And that's over here. If you can see my cursor in the dark blue bar. And the metric goes from quartile 1, quartile 2, quartile 3, and quartile 4. And quartile 4 is deemed to be the most healthy, or meaning the most healthy communities in California specifically. On the left, we have a chart from the California Department of Public Health vaccine dashboard for the general population, narrowed down to LA County specifically. It appears that in general, infants and toddlers in healthier places, or those in quartile 4, are 10 times more likely to get vaccinated than infants and toddlers in least healthy places, or those residing in quartile 1. On the right, we see the demographic breakdown showing the groups with lowest vaccine uptake to be at 3% among American Indian, Alaska Native, and 2% in Black, African American, and Latino communities. I understand that this is a lot of information, and perhaps very sobering information, which can be a source of anxiety for many of us, especially at a time when we are all exhausted about hearing anything related to the pandemic. It can be confusing on top of that. So at this moment, I invite all of us to turn our attention to reliable sources of information as we carry on. So to get started with this, let's talk about COVID-19 vaccines in children ages 6 months to 4 years. And just a gentle reminder to submit your questions to the Q&A or the chat. All children 6 months to 4 years are eligible for the COVID-19 vaccine. On December 8th, 2022, just last Thursday, the FDA authorized the COVID-19 updated bivalent booster for this age group. And on the following day, December 9th, the CDC recommended it. Disclaimer, this is very confusing. So I am sure I will get questions on it, and I'm happy to go over that. But this is taken directly from the FDA. Children 6 months through 4 years of age who have not begun their 3-dose series of the Pfizer COVID-19 vaccines, or have not received their 3rd dose, will now receive the updated bivalent Pfizer COVID-19 vaccine as their 3rd dose in their primary series. Those who have completed their 3-dose series of Pfizer will not be eligible for the updated booster at this time. Children ages 6 months through 5 years of age who received the original Moderna vaccine are now eligible to receive a single booster of the updated bivalent Moderna vaccine 2 months after completing a primary series with Moderna. Last winter, we did see many children in this age group get so sick with COVID that they needed to be hospitalized. So it is important to keep this in mind. Why are more boosters being developed? Why are we changing all these things? Why are we making things more confusing? Unfortunately, the more information we have, the more risk we have for information overload. But the reason for this is because we now have information that we didn't have previously. And so the vaccine development process is able to take that information into account and create more effective vaccines. And I want to also take time to talk about vaccine safety, because this is a major concern that comes up. So vaccines were found to be very safe. How safe? Here are the numbers. Over 220 million people, including over 23 million children, have safely received the COVID-19 vaccine in the US. And getting vaccinated is much, much safer than the risk of getting sick with COVID-19. More about this later on in the presentation as well. There are side effects for everything, like I mentioned. Mild side effects were common, including fevers, which were more common with Moderna than with Pfizer. But fevers are common with lots of vaccines in this age group. High fevers, however, were not common. Most symptoms started 1 to 2 days after the vaccine and resolved within 1 to 2 more days. Also, in September 2022, the CDC reviewed all the safety data in the US on the more than 1 million doses given to children 6 months to 5 years. And the result was that there was only one report of a child with a severe allergic reaction to the vaccine. This confirms this is a rare side effect, 1 in 1 million cases. What about fertility and pregnancy? Many studies found no difference in pregnancy rates among people who were vaccinated versus people who were not vaccinated. The vaccine has been given safely to over 200,000 pregnant people. That's a lot. And on a side note, also, the vaccine has been found to be safe in women who are breastfeeding as well. Next, let's talk about long-term COVID and MISC in children after acute COVID infection. Long COVID includes a wide array of ongoing health concerns that may last weeks, months, or longer after infection with COVID. A review looking at 21 different studies, which included 80,000 children, determined that 25% of SARS-CoV-2 positive children had persistent symptoms at 4 weeks after acute COVID-19 infection. Children have reported ongoing respiratory, cardiac, neurologic, and other symptoms following COVID-19 infection. There's been studies which suggest a link between diabetes and COVID, specifically in children. The illustration on the right provides a visual representation of possible symptoms and organs involved in long COVID in children and adolescents. A picture speaks a million words. COVID infection may cause any of these symptoms for longer than 4 weeks after acute infection. Long COVID is most common after severe infection, hospitalization, or multi-system inflammatory syndrome in children. And we'll talk more about this MISC later in the presentation. However, there have been cases of long COVID in those with mild cases. There is also evidence to suggest that unvaccinated individuals are more likely to have long COVID. By getting vaccinated and boosted, we are not only preventing COVID infection itself and the severity of COVID infection, but we are also preventing the possibility of long COVID if a person were to get COVID after vaccination. Very important to keep in mind. Moving on, multi-system inflammatory syndrome in children, MISC. is a serious condition that can happen in children after infection with COVID-19, even if they had mild symptoms or no symptoms. Who gets MIS-C? Nationwide, information reported from February 2020 to October 2022 tells us the following. There have been approximately 9,000 cases, sadly 74 deaths, median age found to be 9 years old, 60% male, 30% non-Hispanic Black, and 26% Hispanic Latino. Also, hot off the press, on December 8th, the CDC released information regarding MIS-C, suggesting that while the number of cases of MIS-C is decreasing, the age distribution of reported MIS-C cases has shifted to younger populations. So whereas before we were seeing most cases in the age group in the center, if you look at the bar graph up on your right on the top, the age group that was mostly affected by MIS-C after COVID were those 5 to 11. Now we're seeing that shift to children 6 months to 4 years of age. And this is likely because there has been a low vaccine uptake, and there seems to be a correlation between that age group, MIS-C, and the Omicron variant. In California, there have been over 960 cases of MIS-C, many of which were admitted to an ICU. This is indicated by the map at the bottom right as well. Regarding COVID-19 vaccination and MIS-C, not only does the vaccine lower the risk of MIS-C by 91%, in addition, in patients 12 to 18 years of age who were hospitalized with MIS-C, 95% were not vaccinated. However, of those patients who were hospitalized with MIS-C but had not been vaccinated against COVID-19, none required life support. Last but not least, routine immunizations. Data from the California Immunization Registry, or CARE, shows troubling decreases in routine vaccinations. Let's talk a bit more about this. First, let's review the impact of vaccines. Vaccines play an important role in keeping our communities healthy. By reducing deaths from preventable infectious diseases, vaccines benefit infants, children, and adults. There are vaccines at every stage of life. They're part of our continuum of prevention. Vaccines can prevent infection-related cancers by viruses like hepatitis B, which can prevent hepatocellular carcinoma, a very aggressive type of liver cancer. And then there's the HPV vaccine, human papillomavirus, which prevents cancers of the genital and urinary tracts in both males and females. Ultimately, vaccines protect communities in so many other ways. So here we have the recommended immunization schedule for children from birth to 6 years. An important part in pediatric continuum of prevention, which starts with the vaccine against tetanus and diphtheria, specifically against pertussis and the tetanus, recommended at 27 to 36 weeks of pregnancy, with every single pregnancy, not to mention flu and COVID vaccines, which can be provided at any trimester if there are no contraindications. Here, I want to spotlight one of the vaccines that has seen a dip and go a little bit into what this means. So here we see CARE data specific to MMR, measles, mumps, rubella, in 4 to 6 year olds. The area below the solid black trend line represents the number of MMR doses in CARE in 2022, the blue line 2021, the red dotted line 2020, and the gray area under the curve 2019. During the 2020 to 2021 school year, the red dotted line, MMR vaccination coverage among kindergartners nationwide was lower than during the 2019 to 2020 school year at approximately 94%, a level just under the target of 95. So 1% drop. And so the latest data from the CDC shows that the national childhood vaccination rate among kindergarteners has declined by 1% from 2019 to 2020. 1% translates to nearly 250,000 eligible children nationwide who have not received any MMR vaccine, who are not protected from measles, mumps, or rubella infection and complications. Here's a snapshot of the second page of the immunization schedule, spotlighting information for measles and mumps. The last column lists the complications for each. I'll highlight a couple. For instance, not getting the mumps component of the MMR vaccine may cause infertility, given a possible complication of mumps is inflammation of the reproductive organs in males and females. Brain swelling due to measles infection, encephalitis, which though not as prevalent, it does occur. About 6 years ago, 6 years ago, to be precise, I myself cared for a 7-year-old patient with encephalitis as a complication of infection with measles. The patient was partially vaccinated at that time. Lastly, to drive the point home, here we see the number of measles cases reported per year on the axis to the left, and the years ranging from 2010 to 2022 on the bottom. Looking at the last 12 years, it seems case breakthrough occurs every 4 to 5 years. We are following the same trend since 2010, causing us to speculate a possible breakthrough of cases next year or the following. So don't wait, vaccinate. Prevention is key once again. This slide shows the rest of the second page of the chart that I presented information for measles and mumps from. The font is tiny. I don't expect you to read this. I will not read this myself because it's so small, but the picture as a whole speaks for itself. There are many more vaccine preventable diseases and complications that we can prevent, that we can protect our children from through routine immunization. It's part of the continuum of care. Immunizations top the list for keeping our children and ourselves healthy this winter. Other things include wearing well-fitted masks in indoor public spaces, choosing outdoor spaces for gatherings with improved airflow, ventilation, the universal precautions of washing hands often, covering coughs, sneezes, staying home when sick, and testing when symptomatic, or if you know you have been close to someone with COVID or flu for that matter. If you forget everything I just said, the key takeaways are: don't wait, vaccinate, and prevention is key. And at this time, I thank you and I welcome my co-panelists. Here is our disclaimer. Here are some resources. Here is my thank you slide. And here is the beginning of our second presentation. Whenever you're ready, Mariela.
Thank you so much, Dr. Martin, and thank you everyone for being here today. My name is Mariela and Kohulun Hukup, and I am with Para los Niños and Project Innovations Los Angeles. And we are also here to go over some myths that we have been encountering within the community that we live in. But also, before going over that, I also want to mention that as a group of community ambassadors, we are also here to help whoever needs support making vaccine appointments or COVID testing appointments. We're here to support you with that. And let me start by going over some myths, and then after that, we will be asking some questions to our parent that we have here who attends one of our neighborhood leadership groups. Her name is Violeta, but we will begin with the myths. And these are some of the myths that we have been encountering as we bring presentations to the community. And the first one we have is, why does my child need to be vaccinated against COVID-19? The second one we have, weren't the COVID vaccines for children developed too quickly? The third one is, can the COVID-19 vaccines impact my child's DNA? And for the fourth one, we have, are there any severe or long-term effects in children who get the COVID-19 vaccine? So we will begin with the first one. That is, why does my child need to be vaccinated against COVID? And the answer to this is because reinfection is possible. So even though a child or anybody had COVID, they can be reinfected. So there is a possibility for that to happen. And COVID-19 vaccines are extremely effective in protecting against severe illness or hospitalization. So that is the reason why we recommend children to get vaccinated. For the second one, weren't the COVID vaccines for children developed too quickly? And this is another one that we've been hearing lately. And the answer is that there are 4 phases of clinical trials. So before the vaccine even goes out to the public, there's always clinical trials to test for safety and efficacy. And also the testings were being overlapped. So that's what made it seem like it was developed too quick, but there has been testing done before it's even authorized. Also, it's authorized by the FDA. So each vaccine was authorized for emergency use to be based on a total of 8 weeks of information on vaccine safety and efficacy. So even before it's out to the public, even before it's approved, there's trials and there just to make sure that this is a safe vaccine. And for the third myth, can the COVID-19 vaccines impact my child's DNA? And the truth is that this genetic material that is delivered by mRNA, which is the way that the vaccine is delivered through the body, never enters the nucleus of the cells, which is where our DNA is kept. So this vaccine does not affect the DNA of the children in any way or form. And for the last one, we have, are there any severe long-term effects in children who get the COVID-19 vaccine? And it is very rare for any children to have any condition after getting vaccinated with any mRNA vaccine or have myocarditis or inflammation of the heart. And there has been 1 in every 200,000 patients with myocarditis or inflammation of the heart. And so far, there are no cases seen in any of the clinical trials that were done in children 6 months all the way to 5 years. So that is very important to keep in mind because, and another reason why we are debunking these myths is because we have been hearing from the community asking these questions or myths that they have been hearing from other people who live in the same community, from friends. So we just want to remind you that it is important that you get your information from credible sources such as the CDC, the FDA, or Pfizer or Moderna, wherever you're getting your information. Just make sure that it does come from a credible source. I did also want to share that I got vaccinated with my first booster when I was pregnant. So one of the slides did mention that the COVID vaccine is also safe for people who are pregnant or breastfeeding. I got my second booster after I had my baby and I was breastfeeding, so I can speak for myself and say that it is safe. But I also want to introduce one of the parents that attends one of her neighborhood leadership groups. She's very passionate in advocating for the community and also sharing her story and her testimony of her getting her baby vaccinated. So I want to introduce her. Her name is Violeta Recinos, and she's here with us today. And I will switch to Spanish. Violeta.
Sí.
Hola Violeta, bienvenida. Es un gusto tenerla aquí en este seminario, en esta charla. Y me gustaría que usted introdujera un poquito de usted, su nombre. Me gustaría que usted
Claro que sí. Buenas tardes a todos. Gracias por la invitación. De verdad que para mí es un honor bien grande que me hayan tomado en cuenta. De verdad que sí. Soy Nora Violeta Recinos. Tengo 35 años con un bebé de 1 año y 8 meses en este momento. Un bebé post-COVID. Desafortunadamente a mi niño le dio COVID teniendo 8 meses de edad. Se le vio muy malito a mi niño. Y yo era de las que hablábamos internamente con mi esposo acerca de que si íbamos a vacunar o no al bebé, porque teníamos mucha presión familiar encima de que no era bueno, que no podía, que posible las vacunas iban a afectar, que el bebé no iba a hablar, que a lo mejor podía retardar la caminada, que incluso un familiar nos comentó que esas vacunas también es un poquito difícil, pero nos comentaba que era muy grande ¿cómo se podría decir? El riesgo a que el niño en un futuro padeciera de autismo. Entonces, como que nos llenaron tantas cosas la cabeza y nos da el COVID en diciembre del año pasado y fue súper grave. Mi esposo le dio el COVID, luego le dio al bebé, por más que lo cuidamos, el bebé se infectó. Él estuvo 21 días dando positivo después de que estuvimos monitoreándolo. Estuvo 21 días dando positivo. A la tercera semana que lo llevamos ya para hacer el examen y da negativo. En ese primer momento le digo a la doctora, yo quiero que mi niño sea vacunado contra el COVID, porque para seguridad de mi niño y tranquilidad mía como mamá, quiero que mi niño sea vacunado. Mi niño lo vacunamos de inmediato al dar el negativo después del COVID. Le pusieron justamente la del COVID y su primera dosis de influenza. Así que tuvimos un día complicadito con mucha fiebre, muchísima fiebre, pero no pasó a mayores. Gracias a Dios, el bebé hasta este momento tiene ya 1 año después de que le dio el COVID. En este momento él tiene 1 año y 8 meses y no se nos ha enfermado, no se nos ha vuelto a enfermar de COVID. Mi esposo sí se volvió a reinfectar y fue tan traumático pensar que nos íbamos a volver a enfermar de nuevo y gracias a Dios no pasó. Yo puedo decir que la vacuna del COVID sí nos ayuda. Yo también me vacuné estando embarazada. La primera dosis me puse tenía 8 meses de embarazo. La segunda dosis me la puse cuando el bebé tenía 6 meses de haber nacido. Yo estaba lactando y hace 3 o 4 días me puse el booster del Omicron. Sigo dando lactancia materna y puedo decir que soy fiel creyente de las vacunas que de verdad nos han ayudado a estar saludables, a nosotros como papás a estar tranquilos sabiendo que el bebé está protegido y al bebé estando libre de personas que por inconscientes pueden infectar o pueden enfermar a un bebé tan pequeñito. Yo sí puedo dejarles saber a todos, padecemos después de COVID. Mi niño fue diagnosticado con alergias a muchísimas cosas. Un mes después de haberle dado el COVID, él explotó con unas alergias horriblemente graves. Llegó al punto que se le hinchó la carita, las manos, las piernas, todo él estaba hinchado, rojo. Corríamos de un hospital a otro, veníamos con un especialista, íbamos con otro, hasta que finalmente por parte del hospital nos mandaron con un especialista en las alergias y nos dijo que eso era un efecto secundario del COVID, que normalmente eso estaba pasando en niños menores de 5 años porque el sistema inmune de los niños queda deprimido. Entonces es una posibilidad muy grande de que los niños después del COVID padezcan una alergia. Puede que sea una alergia leve, pero puede también que sea una alergia como la que padece mi niño. Hoy por hoy, el bebé no puede comer manías, no puede comer ninguna nut, no puede comer huevito, es alérgico a la soya, es alérgico al trigo, así que tiene una dieta súper estricta y puedo decir que eso sí me entristece mucho porque el COVID sí me lo dejó con un efecto secundario bastante grave, que yo le pido a Dios que conforme el tiempo pase no siga más, porque el doctor nos dijo que esto podía ser de aquí hasta que él fuera un adulto y que él tenía que aprender a cuidarse por sí solo, porque era una alergia bastante extrema y bastante agresiva. Entonces, yo les insisto, mamis, quiero compartir con todas las mamás que yo sí soy fiel creyente de la vacuna, sí soy pro vacunas. Creo que como mamá, yo no quisiera que mi niño se enfermara nunca y siento que haber vacunado a mi niño me ha dado una tranquilidad más allá de decir, mi niño está vacunado, está protegido, puede que se me enferme, pero sé que no le va a dar tan grave como le dio y con las secuelas que me le dejó el COVID. Así que esa es mi experiencia, ese es mi testimonio y como les repito, como mamá, con mi corazón les digo, piensen 2 veces en la tranquilidad de ustedes como padres y en la salud de los niños como sus hijos. Aquí para servirles y muchas gracias, Mariela.
Muchas gracias, Violeta, por compartir su historia y su experiencia. Después de haber compartido esto, me gustaría preguntarle cuál fue su experiencia el día que usted llevó a la vacuna al bebé.
Mi experiencia cuando llevé a mi niño, sobre todo, iba con muchísimo miedo, porque con tantas cosas que nos habían dicho, sobre todo eso de que el bebé no va a hablar, el bebé no va a caminar, puede que se me enferme. Tenía tanto miedo. Hoy por hoy el bebé ya tiene un año después ya un año después de haberse vacunado. Y él es un niño que habla muy bien, camina muy bien. Más que nada era miedo, mucho miedo. Tenía mucho miedo de la vacuna por todos los mitos que nos habían dejado saber.
Muchas gracias por compartir eso, porque esos son uno de los mitos que hemos estado escuchando. Entonces, gracias por compartir su experiencia el día de la vacuna. Otra cosa que le quería preguntar es, ¿usted recomendaría a otros padres que vacunen a sus niños contra esta vacuna de COVID? ¿Por qué es la razón que usted recomendaría o no recomendaría?
Totalmente sí. Yo les recomendaría que tomen en cuenta mucho esto. Si es, hasta mi punto de vista, podría decir, es necesario. Yo pude ver cómo se enfermó mi niño. La pasó muy mal los primeros 8 días. No estuvo hospitalizado, pero de verdad que en la vida no lo quiero volver a ver como lo vi. Sí, yo sí les pediría a las mamás que consideren mucho el vacunar a los niños. Es una arma que nosotros les damos a los niños para que ellos mismos se protejan. Entonces, yo sí les recomendaría que tomen en cuenta o piensen en vacunar a los niños.
Muchas gracias, Violeta, por su tiempo y por compartir con nosotros su testimonio. Se lo agradezco muchísimo y gracias por compartir y ser vulnerable aquí con nosotros. Se lo agradezco muchísimo. Ahora le voy a pasar la palabra a mi copanelista Rubén.
Hello. Hi, everybody. For those of you who don't know me, I'm Ruben de Leon. I'm a senior program officer here at First LA in the communities department, and I'm the host of this event. We are now moving to our Q&A session of our health chat. And my colleague, Marcy Manker, who is a senior program officer in our early education team, will be moderating the questions that come from our parents and also clarifying any further points regarding the presentation by Dr. Martin, Mariela, and Violeta. So without further ado, I will pass it over to Marcy to start with our Q&A. Thank you.
Thank you, Ruben, and good evening, everyone. And thank you so much to our panelists for those wonderful presentations. If I could ask that you all turn your video back on so you can join me on stage. So as Ruben said, we're moving into the question and answer portion of the presentation. We do have some questions that have been submitted. Thank you so much to our audience members who have submitted questions. And please do continue to use that Q&A feature to submit any questions you may have. I'm going to try and group questions broadly if they are similar. And if there are any really specific questions that we aren't able to answer today, we will try and follow up with you individually to get you the information that you need. So my first question is for Dr. Martin. This did come up in our presentation, but it did show up again in the Q&A. There's a question about side effects for young children, and also wondering about any allergic reactions that folks can expect during the vaccine.
Thank you. Yes, thank you so much for that question. And I did see a message sent by our host here, Ruben, who also wanted me to comment on some of the effects of the vaccines in Violeta's child. So I will also comment on that. In regards to the side effects from the vaccine, we need to remember the way I explain it to my patients is we need to remember that COVID-19 has created a state of alert in a child's immune system. So even after the patient, in this case, even after a child stops having symptoms, starts to test negative for COVID, their immune system is still pretty much on alert. So any new substance, any new experience, any potential allergen, there's going to be, there is the possibility of there being an over-exaggerated response, which is what it seems to be happening in terms of with Violeta's experience here with our parent who, shared her story and her child's story as well. And I do want to comment that those side effects that our parent Violeta was talking about, those were sequelae from COVID. These are not symptoms due to the vaccine. These are symptoms or sequelae left over after acute COVID infection. And it's not just me saying it, it's her specialist saying it. It's the allergist who also anecdotally told her that in his practice, this was a very common medical frame, very common medical picture he was seeing with his young patients in his practice. And so we need to remember that, yes, the body can become immune through natural infection, develop this natural immunity. However, the consequences and the sequelae that COVID infection leaves, that risk is much higher than any risk that could happen with a vaccination.
Thank you so much for that clarification. And I have another question for you, actually. Maybe you could speak a little bit to the timing of different vaccines. We had one audience member who shared that they got a flu vaccine back in January, and do they need to get it again?
Yeah, so the vaccine, to make sure that was the, it depends on the age group. It depends on whether it was the beginning of the primary series or ending of the primary series. I knew this question would be coming up, so I did have something prepared. I can try to share my screen if that's okay.
Yes, please.
Okay, so let me close my chat here so I can make. Okay. Okay, here we go. It's not letting me here. Okay, so this is our most current, can you see my?
Yes, we can see it.
You can see it. That's funny because I can't see it. Okay, there. So this is our most current immunization scheduled from the Department of Public Health. And to answer that participant's question, we would really need to know the age, and we would need of the patient, and we would need to know whether we're talking about the primary series or we're talking about a booster. So because this is this chat is aimed towards children, here we have the vaccine schedule for 6 months to 11 years of age before December 8th. I have another slide to share with you after that. So this gives us an idea, basically, of the primary series. Pay attention to the primary series only, not under updated booster. So from 6 to 4 months to 6 months to 4 years, there are two choices, the Pfizer and the Moderna. And dose 1 is given, and thereafter 3 to 8 weeks, dose 2 for Pfizer, or 4 to 8 weeks will be dose 2 for Moderna. Pfizer primary series consists of 3 vaccinations. And for that age group, for Pfizer, at least 8 weeks, that's when the 3rd dose will be provided. For children who are 5 to 11 years of age, there is a separate schedule. So I can totally see how this is confusing, and it's become even more confusing. I will review that and the reason for that. And we can see here there are 2 choices once again, Pfizer and Moderna, with 2 doses this time, separated either by 3 to 8 weeks for Pfizer or 4 to 8 weeks for Moderna. And the reason, once again, why we keep seeing different dosages and new vaccines are being added is because now we have more information. We have new variants that are wreaking havoc. And now we have information and we have tools to create vaccines against specific variants That is the whole point of the updated bivalent booster, to specifically attack that Omicron variant that has been giving us so much trouble this whole year, specifically BA.4 and BA.5. So I do want to stop sharing. But I want to address the issue of the new recommendation by the CDC for the updated booster for little ones. Now the little ones are also eligible to receive that updated booster as well, those 6 months to 4 years. The difference is whether the child receive Pfizer or they receive Moderna, specifically, like we reviewed in our presentation. Very long-winded answer.
No, thank you. That was great information. For this next question, I'm going to direct it to Mariela, although I would certainly be curious if Dr. Martin or Violeta have guidance for this audience member. But our audience member shared that they're having a hard time finding an appointment for a child under 1, and how they might go about making an appointment to get their child vaccinated.
Thank you. We have noticed that there are less places where to get vaccinated and tested than before, but we can definitely help this person find something that is close to where they live, close to their community, and we can help them set up an appointment.
I think the question may have been asked anonymously. So just in general, are there any websites we can direct the listener to, or more general resources?
Yes, I can enter the website on the chat. If would they be able to see that?
You know,
link.
We can put the answer in the Q&A. So if you chat it to one of us, we'll make sure it gets in the Q&A.
Okay, I will do that now. Thanks. You.
Marcy, just to add, thank you for that, Mariela. And just to add, one of my team members also answered on the chat as well. There is a link that was dropped just now with information to our clinic hubs at Department of Public Health. And there's surely to be openings there. And this is a wonderful question because we also want to let you know that we have professionals there who, you know, from the registration person to the nurse, who are there, who work with children. We have toys, we have books. We try to create an atmosphere that is less anxiety provoking because we know it can be difficult to go to another place to get your child vaccinated. As it is already, it is hard to vaccinate children, right? It's not a very pleasant situation when you have children of your own. So we do recognize that, and we do appreciate the feedback, and would be glad to help out as well. So reach out to us with that through that link.
Great, thank you so much. And we will do our best to make that available to everyone in the audience. Our next question was about whether the flu and or COVID vaccine helps with symptoms for RSV in children. And this person was curious if there was any research or information that showed that children who had those vaccines had lesser symptoms if they contracted RSV.
That's an excellent question. Thank you for that. We are seeing the number of RSV cases slowly declining. We are keeping a close watch. However, the numbers are looking better. The number of cases are declining. But with that said, specific studies on the efficacy of the flu vaccine or the COVID vaccine against RSV have not been published, have not been done to my knowledge. In my review from the current literature. However, the same precautions, the same preventative measures that we recommend for COVID and for flu are the same that we recommend for RSV. And those were also reviewed. I believe they were the last slide on this presentation. RSV is a type of respiratory virus that can be spread, disseminated in a very similar fashion, if not the same way as COVID and flu. So masking, hand hygiene, covering those sneezes, those coughs, those all prevent RSV. Unfortunately, there is no vaccine specific for RSV at this time. Most children, it is cited in the literature that most children do get RSV. When I say most, I'm talking about as high as 80% of children get RSV by the time they're 2 years old, and most children are able to overcome that and do well. However, there are other cases where that might not be the case, and usually we're talking about children who have other medical conditions, medical comorbidities, or premature children. There is a medication. It comes in the form of an injection, a monthly injection called Synagis. And that is a monoclonal antibody. It's been around for years. There's been plenty of research on that. Most definitely efficacy and safety. And it is actually an intervention that is recommended for premature and high risk patients who are high risk for RSV. All pediatricians and clinicians who work with children are well aware of the indications for Synagis. That is a prophylactic agent or medication. So it's not treatment, but it is medication to prevent RSV in high-risk patients.
Thank you. And thank you for answering all these questions, Dr. Martin. You've been in the hot seat for a while, but we have just a few more for you. So another question that we have in the chat is around recognizing that vaccines are important, and we're getting a lot of information about why vaccines are important. Yet, we all know folks who've gotten COVID despite being fully vaccinated and boosted, sometimes even a couple times. So if you could speak to that, please.
Yeah, absolutely. I think I touched on this just a bit in the presentation, but the main reason for this is because of the variants that we're seeing. The way I like to explain it is if a person was vaccinated against COVID, it doesn't mean they were vaccinated against all COVIDs. This is a virus. Viruses will continue to reproduce, will continue to, and as the virus reproduces, there are changes that are just randomly made up in the DNA. And some of these changes in DNA can provide advantages against our already formed immunity. So once again, the reason for the updated booster, the monovalent boosters, the first booster we received, I have 4 vaccines. So I took 2 of the Pfizer, I took a monovalent booster, and then when the updated booster came up, this year I took my updated booster. So I have 4. So when I took my monovalent booster, my 3rd shot, my immune system was getting boosted against the original or ancestral COVID strain, but now my body is boosted against Omicron specifically. The more people we have who are not vaccinated, the more the virus has a chance to spread and disseminate. And the more it spreads and the more people catch it, the more opportunities it has to build in these defenses against our immunity. The short answer is the variants, most definitely. And also it depends on a person's immunity level. If we have a person who is immunocompromised, we need to keep in mind, for example, patients who are transplant recipients, they receive a much smaller dose of the vaccine compared to the general population. And so they may actually, their immune system might actually not have enough. They may not be strong enough to mount an immune response that will create memory in their immune system, or they may not have enough vaccine, as it were, to create that memory. But once again, it all depends. But the short answer, concrete answer that we have data for is the variants, and the best way to protect ourselves against those variants is by taking the vaccines built against those variants. And right now we have the updated bivalent booster.
Great, thank you. And I think you may have just answered this, but the question came in, so would like to pose it anyway. One of our audience members is asking that what happens if their son does not get the booster? He has the first 2 primary doses.
Okay, thank you for sharing that. He has completed his 2 primary doses, so I will assume that we are talking about Pfizer, about the Pfizer vaccine that has been completed. So before December 8th, the boosters were monovalent, so they were boosting our immune system against that original COVID-19. After December 8th, we have the bivalent, which is protection against the original COVID-19 and the Omicron, BA4 and BA5. However, if there is no updated booster, then there is no protection against Omicron. And there is also a need for immunity, a boost of immunity, especially during this winter season. So there's the simple answer would be that there is no protection specific to Omicron.
Thank you. And I think this will be our last question this evening. So we have one audience member who would like to know your thoughts on the pill available to take if you do get COVID.
I believe we're talking about Evusheld. Oh, I heard someone. Maybe? No.
That may have just been background noise on my end. They didn't specify the pill, but yeah.
Okay, so I believe we are probably talking about Evusheld. And Evusheld, it is a monoclonal antibody. It's under emergency use authorization, and its age range is for adults and pediatric patients 12 years and over who weigh at least 40 kilograms, sorry, like in clinic mode. And it's been given authorization to basically the type of pre-exposure prophylaxis. So before there is any exposure to, in case there is any exposure, then there is this medication to help against contracting that virus, that SARS-CoV-2 virus, in individuals who are not currently infected. So Evusheld, there's been many studies, not so much in children in particular, but there was a notion that previously Evusheld was only for people who were severely immunocompromised, But actually, that is a myth now that we want to also address. It is always good to check with your medical provider, as the list of indications for Evusheld has become much more extensive, including diabetes, including hypertension, heart problems, obesity. So it would be worthwhile to check in particular with a medical provider in case a person is eligible for Evusheld.
Okay, thank you. And that was our last question today. So we are going to pass back over to Ben, but thank you so much to our audience members for such great questions, and to our panelists for such thoughtful answers.
Thank you, Marcy, for moderating our Q&A. Definitely, we've learned a lot from all the questions and from your insightful moderation for us. Before we close, I want to provide an opportunity for Dr. Claudia, Martin, Mariela, and Violeta, if they have any final reflections before we close, any final thoughts that you would like to give to our audience.
Sure, I can start.
Yeah.
Sure, I can start. I just want to thank you for your time. I know.
I think you're on mute.
Yeah, can you hear me? Oh, okay. Can you hear me? Can you hear me? No.
Yes.
Yes? Yes, Mariela?
Yes, we can hear you.
We're all good?
Okay.
We're all good?
So,
well, with that,
I just want to
thank
you for your time.
Oh, sorry.
Oh, sorry. I just want to thank you for your time, because I know this is a very busy time, 5 o'clock, children, cooking, dinner. I mean, I want to just thank you for allowing us into your space. And also thanking you for seeking out your answers to your questions. We are here to support. We are here to answer those questions. It is your decision. It is your, your child, but we do want everyone to be as well informed as possible with evidence-based information, so that you feel confident and that you feel motivated whenever you are ready. And key takeaways: don't wait, vaccinate, and most definitely prevention is the key. Thank you. That's all for me.
Mariela or Violeta, any final reflections, words of wisdom for our audience?
Thank you everyone for being here. And I did want to share just quickly, like Dr. Martin mentioned, everyone is so busy, but I just wanted to share my screen really quick. This is our information of the group of community ambassadors with Project Innovations LA. We're here to support the community. This is one of our general flyers. We offer sessions for parents, 0 to 5, community group sessions, help with COVID-19 vaccines, appointments, also testing appointments and COVID-19 education, and also connections to mental health and social services. So this is our information, and thank you so much everyone for being here today.
Violeta, any final reflections? Violeta,
sí, claro que sí, nada más que, ¿aló? Sí, nomás no puedo prender mi video por alguna razón. Pero nada más quiero dejarles como algo que yo he aprendido, es que yo soy el abogado de mi niño o de mi hijo, y a mí me toca abogar por el bienestar de él. Así que yo como mamá quiero verlo bien, tengo que buscar la manera de que él esté bien. Entonces, mamis, adelante, confíen. Hay que confiar en Dios, pero también existe la ciencia, y sí, creo que las dos van agarradas de la mano. Así que infórmense, busquen información acerca de todo. Yo creo que Más vale que tengan fiebre un día y no que estén 21 días bajo una enfermedad tan fea como el COVID. Así que muchas gracias a todos y gracias a los doctores y a cada uno por estar aquí. Gracias por la invitación y para todos un feliz año nuevo. Muchas gracias.
Can I just add something really quick? I'm not sure if our person I'm not sure what the question, if the question was regarding Evusheld or not, but I just wanted to add before we close that there's been concern about Evusheld being ineffective against COVID-19 variants. So I'm not sure if I'm answering the question correctly, if it's regarding Evusheld, but I did want to add that as well for transparency. Thank you. That's all.
So in closing, we hope that this chat was informative and that it clarified any questions and concerns that you may have had on the COVID-19 vaccine and any other immunizations. Again, we want to thank Dr. Claudia Martin, Mariela, and Violeta for being with us and presenting all this rich information about the COVID-19 vaccinations and standard immunizations. And just want to note that we will be sending the PowerPoint slides, both in English and in Spanish, to our audience members here, and along with other resources on COVID-19 and immunizations. So with that, just want to wish everybody a happy holidays and stay warm. And until, as they say, until the next time, goodbye, everybody. Ciao.